Okay, so our presentation was done on Angelman syndrome, and our group is with Brittany, Nayeli, and then me.
Symptoms of Angelman syndrome include delayed development showing example giving, no crawling or babbling, intellectual disability, seizures that start around 2 to 3 years of age, sucking or feeding difficulties, problems with speech and balance, trouble sleeping, frequent smiling and laughter.
The treatments and therapies, there is no cure for this disease, so they treat the symptoms, not the disorder. And the children who do have this disorder, they live a normal lifespan. So there is anti-seizure medication, physical therapy, communication and speech therapy, behavior therapy, sleep training, diet changes, and gene therapy. They are still going through trials of the gene therapy, so it is not effective yet.
So the scenario that I came up with is if a patient comes into a office or hospital, the parent having concerns of the child running a high fever. So first I would assess the patient, check the vitals as a parent if they have any concerns besides the fever, ask if the patient has any infection, if they had any seizures in the past. So I would treat the patient for the fever and ask the parents about any other infection like urethral or any other type. And then if needed, keep the patient in the hospital to treat for possible seizures.
Okay, so the cause for Angelman syndrome through the DNA/chromosome level is that there are four different causes. The first is the UBE3A gene is missing on chromosome 15 from the mother. The child has a mutation in UBE3A gene on chromosome 15, or the child inherits two copies of chromosome 15 from the father, or lastly, there's a deletion somewhere on chromosome 15, which makes the loss of expression of mother's UBE3A gene.
Specific details, Angelman syndrome is caused by a pathological lack of expression of UBE3A gene on the maternal chromosome in combination with psychological genomic imprinting or silencing of the paternal chromosome and neurons. Deletion on mother's side of UBE3A, so having an absence of that gene, can also be due to a mutation with maternal copy, makes protein ineffective. And the incidence of Angelman syndrome varies from 1 in 20,000 to 1 in 12,000 live births. So, and there's no gender preference. It can happen in either male or female.
How does this disorder occur? It's a genetic disorder problem again with the UBE3A gene on chromosome 15. The maternal copy of the gene is active in the mother's brain, but it's missing or damaged in the offspring. And the fetus or their offspring can also inherit one copy from both parents instead of just one. Dr. Harry Angelman was the first to describe what's known today as Angelman syndrome in 1965. He observed three children who were not related, but they shared familiar symptoms of severe intellectual delay, stiff jerk gait, lack of speech, seizures, motor disorder, and a happy demeanor. Most cases as why they are not inherited again is because of the deletion in the maternal chromosome 15. And these are our references. Okay, thank
Thank
you.
you.